I'm sure that you'll get a chance to raise them. You can also put them on the chat, and we're going to be keeping an eye on the chat. But of course, you can also ask your questions in the second half of this webinar. So today we are launching our Plain Healthcare Week report, the Starlight report for 2025, 2024. Sorry, I'm ahead of myself. And we are prioritising plain healthcare in areas of deprivation. A really, really important forensic look at this area, very important area, and the impact it has on the children who are treated in different health settings. We've been producing reports for the last 5 years at Starlight, and we bring together the evidence and insights on the importance, need, and impact of health play. Last year, our report focused on trauma as an unintended consequence of negative experiences of healthcare. And so this year, our focus is on prioritising play in healthcare in areas of deprivation. And we have a very, very interesting lineup of speakers at the webinar today. We have 3 colleagues joining us who are going to share their thoughts and wisdom with us. Our first presenter is Sandy Gulu-Utlu, who is our Head of Insight and Impact at Starlight, and she will provide an overview of the findings of the Plain Healthcare Report. She's been instrumental in preparing this report. And I'm sure that many of you will know Sandy. She's been at Starlight for over 5 years and has been really driving forward our Insight and Impact team. The second presenter is going to be Megan Harpham, who is the health play specialist at Leeds Children's Hospital. And Megan works in the Children's Diabetes Centre at Leeds Children's Hospital and has extensive experience working with families living in deprived communities. She will share her experiences of practice and some of the work she has done in the community. And I'm really looking forward to hearing from you, Megan, because I've worked with Lisa before, and we've had conversations in the past about the levels of deprivation amongst the children that attend Leeds Children's Hospital. And our third and final speaker today is going to be Dr. Andrew Long, a consultant paediatrician, has long-standing and successful career in the field of paediatric practice, training and development. And until recently, he was the RCPCH Vice President for Education and Professional Development, and he's currently an RCPCH representative for senior members, senior fellows and honorary fellows. And Dr. Long will be talking us through his reflections on the report and the implications it has for policy in paediatric practice. So 3 very interesting speakers and 3 different perspectives on this very important area. So I'm going to ask Sandy to share her thoughts on the report, please, and the key findings from the report that's being launched today. Over to you, Sandy.
Thank you, Kritika. I would like to start to reflect on the last Plain Healthcare Week reports we've produced. As Kritika mentioned, I'm positively Jurassic in Starlight terms. I even have a dinosaur to illustrate that. Could I have the next slide, please? We started our journey in terms of producing these reports in 2020, because when I started 6 years ago, one of the things that became very apparent was there was bits of evidence here and there. There have been some really pivotal publications, like, for example, Kath Habbuck's book, and also Alison Tonkin produced a literature review for NAPS at the time. But although we could see the impact, we could see how important play in healthcare was, it was not quite tangible in terms of us bringing together that evidence. So one of the first things we did was just to review everything that was out there in terms of demonstrating the importance and impact of play in healthcare. And we don't just want to, hold that knowledge to ourselves. We want to share it with everyone. And that was essentially the birth of our Play in Healthcare Week reports. And over the years, we have been sharing the knowledge and insight that we've been capturing and creating at Starlight, and learning from all of you in terms of how the impact that play in healthcare has. So much so that in 2022, we recognized a need to kind of look at the policy side of things and the practice side of things. And we did a review of policy and guidance and reported on the findings from a consultation Adrian, who you heard speak last week, did with stakeholders and experts on what could be improved in this sector. And we started working with the NHS to build a task force to create standards and guidance for play and a workforce strategy. And I will go into detail about what happened the following year, but in the last webinar, we had a discussion about, how can insights influence practice? How can insights influence policy? How can we make a difference? And one of the reasons why I wanted to present this is over the years, we've collected those pieces, those nuggets of evidence that's shown us really the difference that play can make in healthcare and used it to influence those different sectors. And with that, all of us can create and deliver that change. Next slide, please. So, as Kritika mentioned, our most recent report looked at the experiences of healthcare and how continuous and persistent negative experiences of healthcare can lead to post-traumatic stress disorder, anxiety, and other medical phobias. But health play can mitigate against these effects because what we can see, what we've been able to capture in terms of our evidence, what this space has shown us over the last 5 years, not just us, others as well. And for example, the research that was presented at our last webinar is that health play can improve children's well-being in healthcare, can reduce anxiety and distress, help them build that resilience to cope better with treatment, with the stress, to be more engaged with treatment. And this too can lead to efficiencies for the NHS, can make sure that treatment is delivered more quickly, improve that relationship between health professionals and children. And that has a significant impact. And it's a very powerful tool we can use. And for me, it's a win-win-win-win-win. Next slide, please. But what we showed last year is that just looking at inpatient care and the workforce that we have at the moment, one health play specialist would need to be responsible for 4,000 inpatient admissions a year. And that falls far from what the guidance says, that every child needs to have access to a play specialist. It's really difficult to be able to support a child when you have that number of children to support. And also, we also found out that there were just over 1,000 health play professionals in the UK. And this was as a result of us issuing an FOI request to all specialist and accused trusts, and we heard back from 140. And we know in majority of those settings, they did not have a play budget and they did not have policies or guidance for play. And a lot of the work that Starlight has been doing, and you've seen our policy and public affairs team working closely with the NHS and SOPs, we've been trying to influence that space and address that gap in the work that we do. But this year, next slide, please. In 2024, our fifth Play in Healthcare Week report, we decided to really look at all those other touch points that children have in hospital. And we wanted to look at the most vulnerable children as well. So we asked NHS Digital in England, and the reason we did this is because every nation health is a devolved power, and each nation captures data differently. And so we chose to focus on England because it had the most comprehensive data set of children and young people, admissions, attendances, and also the levels of deprivation. And we asked NHS Digital to tell us between April 21 and March 22 how many admissions and attendances there were for children and young people into inpatient care, A&E, and outpatient care in all acute and specialist trusts. And those are hospital admissions and attendances. And we also asked them, could you break it down by levels of deprivation? Now, if you don't know about the indices of multiple deprivation, what they do with the whole population is look at different factors like levels of income, employment, health deprivation, education, and they use all of these indicators to kind of assess the extent to which a particular community is experiencing deprivation or not. And what they do as well is divide the whole population into 10 equal groups. And what the NHS is able to do is look at where in those 10 different groups the children and young people who are being admitted into inpatient care or attending A&E and outpatient care are. And we consider that, so if you look at the whole population, it goes from the most deprived to the least deprived, right at 50%. That's where deprivation starts. So anyone who's more deprived is experiencing deprivation, and anyone who's less deprived is not experiencing deprivation. That's how we define it. Next slide, please. So if we take all of that into account, the data that we got back was that in between the 1st of April 21 and the 31st of March 22, there were 15.1 million hospital admissions and attendances for children and young people. Of those 15 or so million, there were almost 9 million outpatient attendances, almost 2 million inpatient admissions, and almost 5 million A&E attendances. But the other thing we found out was that of all those 15 million, 57% were from children and young people living in areas of deprivation. And 15% of those 15 million were experiencing the highest levels of deprivation in England. So what does this tell us? Next slide, please. It tells us that children and young people experiencing deprivation are more likely to be in hospital. And not only that, if you look at the other research produced by the King's Fund and by others, these are the children who are more likely to experience health inequalities, more likely to have poorer healthcare experiences. And I don't know if you saw about 3 or 4 weeks ago, there was a piece of research that was published about the experiences of GP appointments for people living in deprivation, how they had poor experiences of that. So that was an indication of that. We also know from other research, for example, from the Child Poverty Action Group and others, that children experiencing deprivation are less likely to have good quality opportunities to play when compared to their peers. And if not supported, these children and young people are likely to experience poorer physical and mental health outcomes. Therefore, if you think of all these indicators, all these factors, combined, this can increase their risk of experiencing trauma associated with hospitalization and treatment. Next slide, please. And I just wanted to emphasize the point that health play minimizes the risk of trauma and other health conditions. And essential to that is the role of health play professionals, because they have the expertise and experience of child development to integrate play into healthcare and will know how to build that well-being and resilience. However, if we could have the next slide, please. Last year, we only looked at inpatient admissions. And so if we combine inpatient admissions and attendances to A&E and to outpatient care, if we were going to look at our health play workforce, which is the same for those acute trusts and for those specialist trusts, and look at the number of attendances and admissions there are to hospital, you will see that one health play professional would, in theory, on average in England, be responsible for over 13,000 children and young people being admitted to or attending hospital. And that can be as high as 19,000 or as low as, well, when we say low as 8,000. And so there's a huge disparity across the country, but also there is, that's a lot of children and young people to be responsible for and to create that positive experience for when they are in healthcare. what I would say as well, recently in our workforce strategy, we produced guidance that talks about there being a ratio of one play professional to 10 children and young people per day. And if that were the case in a year, that would mean that one health play professional would work with 2,230 children and young people in a year. And the reason for that is, you know, for you to work full time, you're also entitled to weekends and holidays, obviously. So, that's what we calculated the annual figure at. And as you can see, even the East Midlands, a health play professional would need to work with 4 times that number of children. Next slide, please. The other thing, I don't know if you were able to attend our symposium a few weeks ago, but we showed a video of what children and young people said it was like to be in a hospital and the importance that play made. And a lot of them talked about how evenings and how lonely, how scary, how boring it is to be in hospital in an evening and a weekend. And we also looked at whether these trusts had evening and weekend cover, and the majority of them don't. And there's some areas that don't have any evening cover at all. Some have a bit more. And you can see there's a huge variation across the country as well. But all in all, in the majority of cases, there isn't evening and weekend cover. So in terms of our report, what we ended on, next slide, please, was really the recommendations that we have in our manifesto. Our position hasn't changed, but what we hope we have illustrated is the increased need for there to be health play services available 7 days a week, and also supported by additional new posts that will be able to support the children and deliver the opportunities for play in healthcare that are so much needed to support the children, to make it's a good quality and effective service. We will continue to work towards influencing and new guidance and standards for health play services and training and doing our bit, but we will also be working to influence others to also create that space. And we think it's very important for play to be integrated within the design and commissioning of children's health services. And ultimately, what we are also advocating for is for there to be a cabinet minister for children that works closely with the Department of Health and Social Care to provide a joint lead on children's play as an essential part of the government's long-term strategy for children's health and well-being. And we're not just doing this. Next year, we will be reissuing our FOI request to understand the extent to which these points in our manifesto are being met. And we will be consulting with different groups to make sure that we ask the right questions and capture the right data, so we can use that as further evidence to demonstrate what needs to change in this area. So thank you very much. Next slide, please. If you'd like to get in touch with me, there's my email, and I'm going to hand over back to Kritika.
Thank you, Sandy. That was really, really thought-provoking and absolutely spot on time. So thank you so much. That's great. I'm sure there'll be lots of queries and observations from the very rich data that you have just presented to us. I am now going to invite Megan Harpham to present to us her thoughts and experiences, highlighting the evidence and insight on her work at Leeds Children's Hospital. So over to you, Megan. Thank you.
Thank you so much. So I guess I was kind of asked to speak here today just to kind of share my experiences in practice, kind of working with children who do live in deprived areas, especially those kind of surrounding in Leeds, which we do have quite a few children who are living in the worst possible circumstances in our area. Next slide, please. So keeping it very simple, my take homes from the report. So Sandy sent me the report, I believe it was last week, to have a quick little read through. And I guess my first main take home was that we can make a difference to some of these families, and just because they are in the more deprived areas doesn't mean that they shouldn't have access to play. And actually we should be doing everything that we can as professionals to give them the access that they deserve, but also that we can empower the families that we meet. Within my professional practice, I work a lot with children with diabetes, and where I'm based is slightly out of the children's hospital, in a more deprived area of Leeds rather than being in the city centre. And kind of that has many plus points, but it also has many negative points, that some of the children from the more deprived areas, whilst we're centred in a deprived area of Leeds, they don't necessarily have the ability to get to us. So actually, if we were to empower families to ask for support and help, especially to somebody who they can approach and who they do feel comfortable with, such as the play team, you know, are we empowering families to kind of take that next step and kind of helping to remove some of those barriers? And I guess it kind of got me thinking about equality and equity. So equality, giving everyone the same thing. I think this picture shows it perfectly. Giving everyone a standard box, because then everybody is the same and we've given everybody the same opportunity. But unfortunately, the child in the wheelchair can't stand on a box. The other child is too small, can't see over the box. So then we need to be thinking about the needs and the specific needs of the child. So in the picture, you can see that the box is turned into 2 boxes and a ramp. Well, actually, that's amazing. And that is fabulous. And now everyone can access the game. But then it kind of got me thinking, well, there's still kind of a barrier there, isn't there? So if you just press next, I think it comes up with a nice little arrow. Yeah. And then my kind of take home question, if you press next again, can we just remove that barrier altogether? And what can we put in place as health play specialists to remove this barrier, rather than kind of doing equity or equality? Next slide, please. So the links to my practice. So as I mentioned, I work at Leeds Children's Hospital, and there is a large level of social deprivation in Leeds, with over 20% of children in the area living in poverty. And I think it states in the report that actually 64% of our attendees and admissions in the region are experiencing deprivation. That's over 50%. That's, you know, every other child that we see is experiencing deprivation in our region. So actually, I was thinking about what I do to support those children and what we're able to do. And I was thinking about some of the plus points and some of the negative points. And I guess one of the plus points that I'd come across within my practice specifically was about the hospital placement. Now, the Children's Hospital is right in the city centre, which is great for the surrounding areas of Leeds, but they're not necessarily the most deprived. There's kind of a nice section in Leeds that kind of does house most of the deprived children, young people. So that was something that actually works well within my practice, is where we're based. But then I was thinking about, actually, these children, do they have access to the basic needs that they need to thrive? And actually, are we, by not supporting kind of community-wise, are we missing out on some of their basic needs and their access to play? Obviously, children have a right to play. And within my work, am I able to give children the access to play that they deserve? Which kind of got me thinking a little bit more about what some of those barriers are. And then it got me thinking about the language barriers and kind of children of ethnic minority backgrounds. And are we removing the barriers for those children? You know, are we sending out appointment sheets in their first language or something like that? Is there more that we can do? And I guess that also links to kind of the ongoing support that we're able to offer. And I guess within my work of diabetes, there's a lot of technology that needs to be used. And so actually, for the children that are in these more deprived areas, do they have access to a phone? not necessarily, well, then they can't access some of their treatment options. So by having children in a deprived area, we are limiting their treatment that we are able to offer to them. And that brought me round to the Core 20+5, which is a NHS healthcare initiative, which focuses on the 20% most deprived children within the UK, and then also focuses on 5 different healthcare needs. So that might be asthma, diabetes, epilepsy. And I guess I was just thinking about what within my practice, within the diabetes section, what I was doing to support. Next slide, please. So something that I had the wonderful pleasure of being a part of is an initiative that was brought about called Super Saturday. I'm sure many hospitals around have this. But what we did is we did some supporting of health inequalities within the community, and that was done by a day out at the market. So not the typical healthcare setting. We sat down in the market, we had lots of toys out, kind of with different specific things behind what we were doing. There was toothbrushing, there was free fruit for children to take, but the main thing was that we removed the barriers. We didn't say this is means tested. We gave the opportunity for every child that came into the market to access all of these toys and all of the resources that we had. So actually we removed that barrier, because sometimes I think some of the hardest things to do is ask for help. And so if we're taking away their need to ask for help, are we actually supporting more children? And I guess it gave opportunity for parents to ask questions, because we were out of the scary hospital setting. Children were more engaged with staff when they found out that somebody was a nurse or a doctor, or a play specialist. They were asking questions. They were kind of really engaged in that healthcare kind of play that we were offering. And it also gave me a chance to do some opportunistic therapeutic play as well, kind of using some blood test preparation to kind of normalize different experiences that they would have in the hospital. Next slide, please. So that was making me think, what more can we do? So obviously we need to do more community outreach, which in an ideal world would be easy, but actually realistically can we do that? Do we have the opportunity? Probably not. So what can we do within the areas that we are working? So then I was thinking, we can remove the barriers, we can offer to everyone, we can provide a service that is for everyone, whether that's 7 days a week, weekends, kind of in the majority of areas where we are seeing these children with deprivation. Because some of these children, they can't help it. They've got these social determinants of health that kind of, whether that's the school that they go to, or whether that is a predisposed condition that they have, or whether it's because there's mold in their home and so they're more likely to develop asthma or something. Kind of what can we do to support them? And then what it boiled down to realistically was that all we can do is to try our best, which is a bit of a rubbish thing, because we want to be able to do more, but actually all we can do is try our best and kind of support every child in the way that we know that we can through play. And even if we've put a smile on a child's face or given them kind of a reward, whether if they've done something in hospital or they've experienced something in hospital, that might be the only time they smile that day. So actually, can we put that smile on that face and try our best? I think next slide, please. I think it just says thank you. So thank you so much for listening.
Thank you, Megan. That was absolutely inspiring. I made so many notes, and it's got my head buzzing about all the things that you raised and what a difference you are making in that community. What a difference you're making. So thank you so much. Right, our final speaker for this webinar is Dr. Andrew Long, and I would like to invite Andrew, please, to speak. Andrew doesn't have slides, but he's going to be speaking to us. So I hope we can then remove this slide so we can see Andrew.
Thank you very much indeed, Kritika, and thank you to the two previous speakers, because you've set the context beautifully. I'm not going to speak for very long because you want to have time to ask questions and to make comments. But I have the privilege of having spent 34 years working as a consultant paediatrician. And even greater than that, I had the privilege to work in South East London for 20 years and Central London for 10 years. And whilst South East London would be perceived to be amongst the privileged sector of the country, I recognise from the report that there's still only 1 in 17,000 play specialists for the population there. And like every other part of the country, there's pockets of deprivation and there's huge areas of socio-economic divide between the patients that we look after, no matter where we work in the country. So we're not dealing with a regional problem, we're dealing with a universal problem. Now, I have the opportunity to work as a trustee for a hospice for children and young people in South East London. And again, the challenge for any child who comes into hospital is that if they come in for an extended period of stay, as many of our children and young people do, particularly the most vulnerable, we know that they are going to suffer harm as a result of that, just being in hospital for that period of time. And I have had the fortunate experience of working alongside play specialists for all of my professional career, and it's been most valuable. It was a real privilege, but also a challenge to receive this report and to read through it. I think it really spoke to my heart in terms of my understanding of the challenges that we face now as healthcare professionals working in an environment that is still poorly funded. Aradaz's review shows that we still have a way to go in order to restore the NHS to a state of health, and I think that's really important. One of the things that I think that we need to be aware of is that the current government's pledge is to create the healthiest generation of children ever. I think we need to start at root cause. We need to say we have to reduce that socioeconomic divide. Sir Michael Marmot has done huge works of saying there is an unacceptable divide between the rich and the poor in this country, and that is harmful as far as children and young people are concerned. And what this report drove home to me is that just coming from an area where there is socioeconomic deprivation makes your risks even greater of both physical and mental harm, and that's both within and outside hospitals. So in the community healthcare setting, in the hospital healthcare setting. And I think as healthcare professionals, we need to be committed to providing the best experiences for our children and young people wherever they enter the health service. So I think that we need to commit to supporting children and young people wherever they meet the health service. And I have to say my personal experience of working alongside play specialists has been amazing in terms of the way they've been able to enable us to deliver a higher quality of healthcare and really a much more cost-effective way of delivering healthcare. Now, the Royal College of Paediatrics and Child Health, who I've had the privilege of working alongside for 20 years plus, has been committed to say we need to make sure that we support both the government in terms of its initiatives. We need to challenge them. We need to say, how are you going to invest in the next 10-year plan for the future? How are you going to make sure that the workforce is fit for purpose to deliver the type of care that we would wish for children, to create the healthiest generation of children ever? And so the Royal College of Paediatrics and Child Health has recently produced their strategy for the next 10 years of how we're going to work actively and alongside third sector organisations such as Starlight to say, how can we make sure that children and young people have the best experience of healthcare ever? And how can we make sure that they do that? And the government, the RCPCH has also produced a blueprint to say, we think that the time is right to focus on children and young people in order to prevent later development of both mental and physical health care problems for the future. I was really challenged this week when I heard about the issues related to dental care for children and children being admitted to hospital, and London has one of the pockets of the worst dental health care. And I think that that is all about us saying, how can we get messages through to children and young people, but also to their families, to give them the support to make sure that we do produce the healthiest generation of children ever. So thank you very much to Sandy and to Kritika for inviting me to present today. And I think this report goes a huge amount of way to saying and supporting the work that Sir Michael Marmot has done to say we need to focus how we invest in the health in the healthcare workforce to deliver the type of care that we wish for our children, our grandchildren, and young people across the board. Thank you, Kritika. Thank you, Sandy.
Thank you so much, Andrew. That was really, really a very powerful contribution, and looking at it in a very broad strategic way about how we can influence policy at the very highest level to make the change that we all know is required in this space. Thank you so much. I'm going to invite any questions, observations, comments. So please put your hand up so digitally. So raise your hand and I should be able to see you. And also you can put questions, comments in the chat. And I'm going to invite May, who's a colleague from Starlight, to just keep an eye on the chat and to raise any interesting comments and questions that are coming up. So has anybody got any comments or questions, observations? Don't be shy. May, is there anything in the chat?
Not at the moment, but maybe people are typing it out as we speak. But yeah, I'll let you know if anything comes through.
Okay. Sandy?
Oh,
Diane.
someone's got a...
Excellent. Okay.
And I just wanted to comment. I just wanted to comment. Hi, I work in the community, and just building on what I think was it Megan said in her thing, that actually in the community we're in a really, really good position to help bridge that gap, because we go into the home, we really develop close relationships with the families and the extended families, and we can really get a clear picture of what's really going on for the family. And also it puts in a really good position to signpost. So in a hospital, it's quite tricky. If a child is discharged, you could give them a leaflet, a phone number, you could even try and connect them. But can you really realistically follow it up? Whereas we can, because they're open to us, we can touch base again and really make sure we haven't just signposted them, that we've really connected them.
That's such an important comment, Diane, because you, as you say, you're really at the front face and you are interacting with them, and you can really understand the reality of what's going on for them. And actually that work that you do, and then thinking about the presentation that Sandy did about the real lack of capacity in the system, when we know that this is possible, that this can be done and it can have a real impact, and yet there aren't enough people in the system to do this work. And that's why it's so important that we always keep reminding whoever will listen, and the work that Adrian at Starlight does, Adrian Vose, who's head of our policy and public affairs, about making sure that the right people are listening to this and influencing the development of the workforce, so that we not only have money in the system, but that there are the right people with the right skills and expertise to do this work. I think we've got to just keep on banging on about this, because it's to anybody who will listen. And actually politically, as Andrew has said, you know, that there is a commitment to have the healthiest generation of children. So what does that mean? What does that look like? And what about the children that we all support? So I think there are real opportunities at the moment for us to do something really interesting here.
And we're really
Thank you.
hoping the state system picks it up really, really quickly. But in the short term, it's about knowing what else is out there in the community and just making sure those families are accessing as much as they can to bridge the gap.
Yeah, thank you. Thanks, Diane. I noticed there are some things that have come through on the chat. May, is there anything you want to? Yeah.
Sorry, can I just come in on what
sorry,
Diane
Sandy.
said? Yeah. We also asked community and mental health trusts to tell us what the play provision is like in those settings, and from the evidence we gathered, there was only 13 health play professionals working in the community, which really demonstrates the need to focus in that area and how sparse the resources are. And it would be great if we could meet Diane to really show the difference, to really capture that difference, because I demonstrating the evidence, what Megan has spoken about, what you're talking about, and really harnessing that and showcasing that would be really important to show.
Nikki's saying there's over 100 of us, so there's certainly
Really?
something that we need to look into.
Okay, so we need to speak
Nikki.
to the people who give us the evidence.
Yeah, May, can I ask you to see if there's anything that's going on in the chat, please?
Yes, so I'll go to the questions in a minute, but I just wanted to highlight a comment from Jessica, who's just saying how shocking the numbers are in terms of the ratio of children's admissions to health play professionals. And in her trust, she's the only play professional who works past 4 and working late into the evening. So I think that's a really nice example there of kind of bringing to life the stats in the report. I'm going to go to some of the questions just at the top of the chat, which I think, if I understand them correctly, both relate to the workforce strategy and kind of new policies. So Catherine asks, when's the date that the new policy is being released to us and what does it include? And similarly, is there a time frame for these changes, such as more specialists or more services? I presume it's going to take years. That's what Emma says there. So potentially a question around kind of changes in practice and when new policy might come in.
Adrian, can I invite you to comment on that, please? And just introduce yourself, please, Adrian, as well.
Thanks, Kritika, and thank you for the question. Yeah, I'm Adrian Vose, Head of Policy and Public Affairs. If by new policy you mean the new guidance and standards that we've all been waiting for some time now, we are told they are going to be NHS England publications. They're not in our gift to publish. We led the work with NHS England in developing those documents and drafting them. It was a huge effort that many of you on this call were probably involved in some way in that work on the task force. The documents are with NHS England. We're meeting with them regularly. We are promised that they will be published imminently, but we still don't have a date. There has been an election, of course, which has delayed certain things being produced from statutory bodies in general. There was also some restructuring at NHS England. We know that delayed things, but we are confident that they will eventually be published, and we hope that that will be this year, although we still do not have a date. As far as the wider question about workforce development, I mean, that really is going to be a question for the government and the NHS. And our aim as an advocacy body for children's play and healthcare is to provide this evidence to ministers and to meet with policymakers within NHS England and within the government, the Department of Health, to persuade them how important this is. And there is a new NHS long-term plan being prepared. So our aim is to have conversations with government, with officials, with ministers, to persuade them that the role of children's play in healthcare, and in particular the role it can play in supporting children from deprived communities to have better equitable access to quality care and treatment, is part of the long-term plan for the NHS. That is our aim, that's our ambition. Ultimately, it will be for the government and the NHS to decide where it puts its resources.
Thank you, Adrian. Thank you. Any other questions? Anybody wants to ask anything or comment before we go back to the chat? We've still got a few minutes. Tom. Hello, Tom.
Hello, nice to see you all.
Yeah,
I'm
lovely
Tom.
to see you.
I work at Little Journey, and thank you to all those who presented today. Really interesting stuff. And I'm not sure if it's a question per se. It just seems like the big gap here is, it came off Megan's point and off Diane's kind of question as well about being in the community, about how some of those communities, or the most deprived communities, aren't necessarily near a hospital or a hub where a lot of effort can go into making fantastic resources and go into hospitals and see them, I guess, as getting them into people's hands. And then coming back to Dr. Long's point as well about improving those healthcare experiences, but improving that experience starts with preparation ahead of time. So it's that balance of, there's stuff that can be done on the day once you get them into those hubs. But so I guess the question could be, in terms of any healthcare specialists on the call or any community workers on the call who have any examples, or I guess any data around what resources are being accessed, or any particular success they've seen with certain types of resources that work in the community in that kind of preparatory basis, rather than waiting until on the day. So it's almost, no, it's not too late, of course. A smaller difference can be made on the day, but how to kind of get all of these, well, everyone spends a lot of time in preparing all these amazing resources, but how can we get the access? How can we bridge that gap ahead of time? So yeah, I appreciate that it's a difficult question to answer, but I don't know if anyone had any kind of novel examples or particular success stories in that sort of preparatory space.
Thank you. Great question, Thomas. Great question. Anybody want to respond of something that you've tried and it's worked and it's been successful? I mean, Megan, you shared some really great examples with us. I don't know if you want to elaborate on any of that, or anybody else have any examples? Lisa.
Well, good afternoon now. Sorry, I've not had my lunch yet. So I'm Lisa Beaumont, Play Service Manager at the Children's Hospital. So I think in terms of resources, one of the resources that we use, and I know a lot of trusts use, is the Leeds Children's Hospital TV. So, you know, it's a resource that can be accessed in the community. It can be obviously worked with children coming into hospital. And also, you know, we're getting more of our clinical nurse specialists posting up films up there, which obviously enable for repeat information in education in terms of what's needed for children coming into hospital. So I think that's been hugely popular. It's not perfect because it's not delivering it as a play specialist would. However, in the terms of, you know, shortage of resources and people not all have access to play specialists, I think it's a resource that is used widely now with GPs and phlebotomy departments and other practices. So yeah, I think that's something that we use quite widely, and a lot of hospitals are using it. It's not specific to their department, but, you know, it's a resource that you can send out for families to use and share. Thought that might be helpful to mention. Thank you.
Thank you, Lisa. Chris Banks from Torbay in South Devon.
Hello, everyone. I just wanted to say that, yes, Thomas, we use Little Journeys down here. We've started using it quite recently. We've got the day surgery unit, Little Journey. We've got blood clinic, and we've got an MRI. And so when we sort of ask parents to download, you know, the little app, they can take that home and use it as a preparation at home, which is proving to be quite successful. So yeah, we are using it down in Torbay.
Thank you,
That's
Chris.
Thank you. And the next thing then is, when we talk about deprivation, is that next thing about the digital divide as well. I know this was touched on in the presentations. That's also lots of online sort of things being made, but then we're sort of looking at kind of how you can reflect that preparation in an offline pack as well. But then the question then becomes, how do we get offline materials? I know, again, it's sort of, there's lots of offline stuff within hospitals, but I guess it's getting those bits over. So you kind of tried to fix one problem and then something else brings us somewhere else. But no, thank you both for those responses. That's great.
Thank you. May, is there anything in the chat that you want to bring to our attention?
There are no further questions, but just generally lots of comments around going back to the community conversation and having play delivered in the community. Jessica again says how how beneficial it is to have play delivered in the community. Michelle saying that she's a volunteer, a play volunteer, and there are play specialists in clinics doing distraction play, but just generally more play specialists are needed. So lots of things sort of relating back to what we say in the report. So yeah, no questions, but they're the sort of things coming up in the chat.
I think also that answers your question, Tom, about how it is important to have play in the community and how you can do that off non-digital stuff through the community play team, for example, and how powerful that is.
We do have just on the community. Oh, sorry, Katika.
That's all right, go for it.
Just a question that's come through on the community note. Question for Sandy from Stacey, who says, how did you collect the data for how many community play specialists there are?
That is a great question. I issued an FOI request to every community trust, asking them about how many play specialists and other health play professionals there were, and what came back was 13, which clearly is wrong. And I think one of the things that we need to tackle is actually that recognition of the profession and the people who respond to these FOI requests and generate data. People like also NHS Digital need to understand the different health professionals that work within their settings. Because from what I understood from doing our FOI request, often that request made its way all the way down to the play team to ask the play team, what does play look like for you guys? And then made it all its way up to us again. And there's a lot that needs to be done in this space in terms of raising that recognition within the people who work in the system.
I'm sure we'll look into that further, won't we, Sandy? We've now got 4 minutes left. And I'm going to invite Adrian to very briefly say what you need to, Adrian, and then I'm going to wrap up, if that's all right. Adrian.
Just to quickly say that both the guidelines that NHS England are preparing to publish and the new recommended standards for health play services each emphasise the importance of the community play element of the play team and community health play specialists as being an important part of the service. So they are featured very distinctly and prominently in both documents. So hopefully that will help to raise the profile.
Thanks, Adrian. Thank you. Okay, so I'm just gonna wrap up in terms of what we've heard and what the key takeaways may be for you from this webinar. I think we've heard about the impact of the social determinants of health. We've really understood from all three speakers about the impact that has on children and young people and the risks to their physical and mental health of those social determinants. We also heard that we know that there are not enough health play professionals in the system. However you cut it, however you look at it, there are not enough of them to work with children and young people. And it's really quite stark that the paucity in numbers is very, very stark. We learn that the majority of trusts do not have evening and weekend cover. And all of these things are related to our Starlight's manifesto and what Starlight's ask is of commissioners, of NHS England, of policymakers much more widely. This is what children deserve, and it's their right to have play while in when they're being treated for their health. And so it's upon all of us to make sure that we're shouting loud about these things. And Megan, from your presentation, the whole thing about equality and equity, many of us will have seen that before, but it's such a great reminder that it is all about equity. It's about and it's about keeping that child at the heart. You can't have equity unless you understand that child and their needs and what's happening in that family. So it's keeping that child in their heart. And access to basic needs to thrive is what you said. How can we ensure in our roles, whatever our roles are in the system, is that we can enable and provide access to children and young people so that they have the basic needs to thrive? And how can we help to remove those barriers in whatever way we can? And I loved what you said about, all we can do is try our best. And that may not seem a lot, but actually, none of us individually, we can't change the housing system. We can't change, you know, how the air is being polluted, not individually in our roles, but we can influence it in a very big way, so that all those social determinants have a minimal impact on children and young people. We can influence it, but we don't have the direct levers to change that. But what we can do is try our best in where we do have control, and we must never forget that. That is so key. It's not about, well, what can I do? Well, actually, there is a lot you can do, and you share that with us, Megan. So thank you for that. And Andrew, thank you so much for just, you know, lifting us up, what I call on the balcony, when we are seeing a much, you know, that wider picture about where are those different levers, and there is so much we already know. And what can we do about it? And it's a call for action, and really taking that forward. And the time is right. Andrew, we were at a symposium recently that Adrian and his team had convened, and Richard from NHS England said, policy changes in waves. Well, we are definitely on the crest of a wave. And we now, it's our duty to make sure that we can enable that to happen in each of our roles, whatever we do, whatever roles we have, that we make sure that change can happen. And thank you so much for the commitment from RCPCH for this work. Thank you. So I'm going to finish off this webinar. Thank you all for attending. I hope you found that useful. And we have a webinar, a Starlight webinar next week as well, which is really focusing on practice. And Laura Walsh, our head of play, is going to lead that webinar. I hope you sign up for that. I'm sure you will find it very interesting. And so thank you all very much, and hopefully see you next week. Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.
Thanks, everyone.